Hi, Mrs. Clark. My name is Paul Clay. I'm a physical therapist with Mission Home Health. How are you today?
I'm fine, thank you.
Good, good. Today what we're going to do is I'm going to ask you some questions about your health, talk about your history, see if you have any issues with falls and that kind of stuff. And then what we're going to do is we're going to go over and do a couple of tests that we like to do to test your balance and see how you do with your mobility and see if there's any deficits that we can recognize. And then we can look at putting together a treatment program that's going to help you to prevent falls and get back to doing what you really want to do. Okay? All right, sounds good, sounds good. So tell me about you, a little bit about you, your health. Any health issues that I should know about? Anything you've had trouble with in the past?
Yes, I have COPD.
COPD? Okay.
I've had several eye surgeries, and I have had 8 foot surgeries and a hip replacement.
Which hip did you have replaced?
The right.
Okay. When was that?
3.5 years ago.
And you mentioned earlier before we got on camera that you had some issue with your knees as well?
Yes, both knees have been diagnosed as bone on bone. They want to replace them. I use the brace now to help me walk straight.
Okay. How about your pain level? Do you have a lot of pain that restricts you throughout the day?
Most of the time, no.
Okay.
I have twinges with both knees, my back. I also have arthritis in my hands.
Okay. And that's important to know because a lot of time, people using assistive devices to ambulate, if they're having trouble with their arms and their hands, that can be a factor. So good to know that too. Okay. How about any issues? Have you had any falls recently, say in the last 6 months, 6 to 8 months?
Just one.
You've had one fall? Okay. What happened with that? Were you at home or outside in the community or?
I was crossing the street and tripped on a bad spot in the pavement.
Okay. Anything that came out of that? Did you hurt yourself other than probably scraped up your knees and stuff like that?
Just a few bruises.
A few bruises and bumps, but no fractures or anything like that?
No.
Okay. As far as day-to-day, so just that one fall, it sounds like it was outside of the home. Inside the home, no falls or any trips or any of that kind of stuff? Okay,
no.
Perfect. Any functional deficits? So anything that you're struggling with right now as far as the day-to-day activities that you like to do?
Well, I can't dance anymore because of my feet.
Okay.
So. But day to day, no.
So day-to-day stuff, bedroom, bathroom, kitchen,
No,
do you
no
garden,
problem.
any of that kind of stuff? You're doing okay with that day-to-day stuff?
Yes.
Okay. And what about getting out of the house? Do you find that that is difficult and taxing? Do you have trouble getting out of your home, maybe getting to your car, getting your friend's car, that kind of thing?
I do have problems with friends that have low cars,
Okay.
getting in and out. The reason I bought the car I have now is because I can get in and out of it easily.
Okay, okay. Good. Anything else that I should know about you? How about any vision problems or any hearing problems, anything like that? Any problems with blood pressure?
No problems with blood pressure. The eye surgeries, I've had cataract surgery in both eyes, and I had a partially detached retina.
Okay. So as far as your vision, do you wear glasses a lot for day-to-day function? Don't wear
I work
glasses?
just fine. I can read with the way
Okay.
the lenses are.
Okay, so
We're
overall
implanted.
your eyes, no double vision, blurring, any of that kind of stuff?
No.
Okay, good. Because that stuff's important to know. Be a big factor in potentially falling and all that kind of stuff. So eyes are okay. Any trouble with your inner ears at all?
Just that I know the specific problems, but I do notice that now I'm starting to have problems in big rooms with a lot of people hearing conversations.
Okay, okay.
But other than that, I was tested as normal range,
Okay,
but probably lower end of normal at this point.
okay. Any issues with dizziness, any of that kind of stuff?
Not
Vertigo
usually.
type symptoms? Okay, good. Okay. Anything else that I've missed as far as you feel it might be important as far as your health? We talked about the hip, we talked about the knees, ankles.
I think that's enough for one person.
Okay, good, good. But generally, you're pretty active?
I'm reasonably active.
Okay, good, good. That's excellent.
I do exercise every day.
Okay. Well, that's a big part of preventing falls is daily or, at least every other day type of exercise. Keep your body strong, flexible. Some of the systems that we're going to talk about that affect your balance, we can look at some training, but really, if you don't have that strength and flexibility to, do your day-to-day activities, then you're going to struggle. So I'm glad that you're doing that. So what we're going to do now is, unless there's anything else you want to tell me, we're going to go and do a couple of tests that check your mobility and also check some of the balance systems that affect your balance. So one of the tests is called the get up and go, or we sometimes call it the tug test. Very simple test. Basically, you're sitting in a chair, you're going to walk 10 feet, you're going to turn around, you're going to come back and sit down, and I'm going to time that motion. And we'll practice once, so you got a feel for it, and then we'll do it. And again, if you hit a certain amount of time, it's going to determine whether you're at risk for falling. So we'll do that. So that's the get up and go. The next test we're going to do is called the modified CATSIB test, which is basically, I'm going to look for the actual terminology. It's the clinical test of sensory organization and balance, kind of fancy. So that's why we just call it the modified CATSIB. And basically, we're going to do 4 individual tests that are going to look at different aspects of balance. The 3 main factors are your inner ear, or your vestibular, your visual, and your somatosensory. Your somatosensory is a fancy way of saying how your body, like your joints, perceive movement and your body in space, and then send those signals to your brain that then puts that all together and helps with your balance. We call it somatosensory. So the test we're going to do, the modified CATSIB, is going to look at those three systems and see if there's any deficits, and that will help gear us towards putting together a program for you that can help you with your balance. Okay? So let's go and we'll do the tug test first, and then we'll do the modified CATSIB and see how that works. Any questions or anything?
With or without shoes?
You can wear, well, for whatever's normal for you. The idea of doing these tests is to standardize them as much as possible. We want to do test 1 and the tests 30 days later as close to exact as we can, and make them the same so that the results are very accurate and reliable.
The one thing I forgot to mention before is that I do wear a 3/4 inch lift in my left shoe as a result of the hip surgery.
Okay.
So one
And
leg
that's
is
in
longer than the other one.
So you have that embedded here in the
Yes.
shoes you're wearing? Okay, okay. So we want to make whatever's normal for you. If you normally wear those shoes around the house and to go out, then I want to test you in that. For the modified CATSIB test where we stand on the foam, I'll probably have you take those off, and we'll just stand in bare feet on the foam. Okay? And then next time we retest you, we'll do it all the same way, so those results are reliable.
Right.
Okay? All right, I think that's good for now.